Hi, Mark. Thank you so much for joining me in this podcast episode. Really appreciate it. How are you today?
Hello, Russell. Thank you for having me. I'm very good, thank you. How are you?
Yeah, I'm doing well as well, and super excited to have a conversation with you on anxiety, which is like millions of people around the world suffers every single day. And a lot of them don't know what's actually going on, and they don't know like terms of anxiety. They probably think they got some other kind of illnesses. They're going back and forth to doctors and not getting any proper diagnosis and like a treatment for that. And so
Mhm.
I'd love to have a conversation with you. And obviously, you advocate on that, and you're a hypnotherapist and specialize on anxiety. So, how we can heal our inner child so we can have a control over anxiety and like get a better life out of that. So, with your experiences, what do you see in people have in common in terms of like anxiety? Why do people get the anxiety in the first place?
Okay, so anxiety is a conditioned response. Is fear is part of the fight or flight response. When we experience fear,
Mm.
we experience symptoms that would be very beneficial in a life or death situation, such as sweating to calm us down. If we were about to have to exert some kind of physical activity, the blood flow increases to get blood and oxygen flowing to the muscles so
Mm.
that we can either fight back or run away. When someone lives in fear um, constantly, they can start to experience, anxiety. They can start to find that they have that constant state of anxious feelings, and they can become triggered to various things. When we grow up with dysfunction, it can cause all kinds of insecurities. What a child needs for healthy psychosocial development, they need what are called good enough parents. A good enough parent is going to provide the child with unconditional love. They're going to know that they're always going to get their needs met. Um, Most people have their own trauma issues. Most parents haven't resolved their own problems, and so that creates dysfunction here in the child's life that stops them from being good enough parents. And what we don't heal, we either repeat or enact on others. So if a parent hasn't done the work to heal their own inner child, deal with their own insecurities, they're going to pass them on to the child.
Right.
Um, so how inner child healing can help with anxiety. Um, it's about becoming a good enough parent to yourself. It's about giving yourself unconditional love,
Mhm.
unconditional acceptance, making your inner child feel safe, feel secure. We all have an inner child. Again, growing up with dysfunction stops us from, growing up functionally. Part of us becomes arrested, and part of us is always, going to be stuck in the past. So when someone experiences anxiety, it's always to do with some form of trauma, as I said, usually in childhood. But it can also be from, PTSD, from a one-off traumatic event. Um, Again, studies have shown that some people can be experienced to a traumatic event and be able to process it and get on with their lives. Others are, stuck with PTSD, and in the emotional part of your brain, time and space meaningless. So something that happened 10 seconds ago is going to carry the same weight as something that happened 30 years ago.
Mhm.
So that trauma is going to be live in their mind, and they're going to, flash back to that. But again, the reason that some people experience PTSD and others don't is it is to do with, having good enough parents and growing up, knowing that you're going to get your needs met and that you're going to be loved no matter what.
Yeah, so basically it's like whatever happened in our past as a child could be a trauma, PTSD, or like they face certain kind of events and then they couldn't get out of that and it stuck with them for like a long period of time. So that's why like even though as they grow up, they feeling them kind of all physical kind of symptoms. So moving forward is like what kind of symptoms can someone with anxiety can feel like on their body or sensation, then they can realize like, yeah, I got anxiety, or like they're not kind of some other kind of medical condition after rule out with the doctor?
Well, like a constant feeling of unease, like there's something, wrong, always worrying about the worst case scenario, always, having a negative view on life, looking for things to go wrong. Physically, as I said, the increased heart rate, blushing, sweating, things like IBS can also be related to anxiety and living in a constant state of fear. Again, the theory on why people who suffer anxiety can also suffer IBS is because if you've just eaten, that's energy that your body could be using to make your escape. So it's going to try, dump that stuff in whatever way to allow you to use that energy to get away. Also, if you're being chased by a predator and you vomit or whatever, that's something that could distract the predator and allow you to make your getaway. So people who have a lot of anxiety often have issues with digestion. And again, if you're living in a constant state of fear, your body's not going to be worried about illnesses and viruses and things, because that's energy that could be used to allow you to escape, whatever the threat is. So that energy is going to be diverted away from your immune response. And people who suffer with anxiety and stress often experience more colds, more illnesses than people who don't.
Yeah, I totally agree on that because I've been dealing with anxiety last 6 months now. And I have dealt all of my life, but it wasn't that extent compared to right now. But the main reason was like I've been diagnosed with an inflammatory bowel disease, IBD, so ulcerative colitis, and then put me on like about 3.5 months on steroid medication. So with the steroid medication, they imbalance my hormones. So I'm constantly on flight or fight mode. So either I'm worrying or not, like I feel like all physical symptoms. Last 4 or 5 months, I felt with like a constant dizziness and heart palpitation, feeling like on edge all the time, like worrying about things, all the time, like being scared. I couldn't be faced on like a crowded area. Last 2 weeks back, I had like a what's it called, like a stroke type of like a symptom, like I had an anxiety attack that mimicked like a stroke. I'm having a stroke. I've been to emergency and everything. They checked everything. They found out like it's an anxiety attack. So it's like I got like a visual aura. So half of my eyesight is gone, like blinded for like about 20-25 minutes. And after that, like it came back. It happened like 3 times in the same day. I felt like a heart attack as well, like a few times. Like that was like extreme anxiety. So yeah, like and also like my IBD gets flare up. Like every time my anxiety goes up or like anxiety attack comes in, I start to bleed again because of my IBD. And the both works in the same way, and it makes it like one thing another worse. So that's need to be like a balanced out as well, like we're working on that with the doctor. So yeah, a lot of people get like a different kind of anxiety. My sister, they get heart palpitation all the time. Like I get like a all kind of symptoms. Like whatever in the list, I get everything, like acid reflux, like a vomiting, feeling nausea, loss of mucus, like you
Yeah.
get prone to a lot of infection. I do that as well. So what is the way to get out of that, or like start to feel like a bit normal for those people who are like suffering? I know you mentioned like inner healing. How do you go about the
Mhm.
inner healing, and what kind of component you need to focus on that?
Well, I have a 4-week inner child program. On the program, we write letters to the inner child. We write letters from the inner child to the adult self. We use hypnosis to visualize and reconnect with the inner child, make the inner child feel safe, feel secure. And hypnosis can help in many ways. One of the ways is it increases your ability to visualize, and your mind can't tell the difference between a real or
Yeah.
an imagined event. So by imagining yourself the way you want to be, you actually create new pathways in your brain. The more you visualize yourself that way, the stronger those pathways become, and the more you can start to become that person. Also, the more you relax, the easier it becomes to relax, the more your overall kind of levels of relaxation will be. And when a person experiences trauma, the emotional part of the brain actually increases in size, and the thinking part of the brain decreases in size. So with a regular relaxation practice, you can start to increase the thinking part of the brain, decrease the emotional part of the brain, which leads to better emotional regulation.
Mhm.
And hypnosis can also help because we can use it to desensitize traumatic memories. If someone has a traumatic memory, we can use hypnosis to remove any emotional charge from that memory. The person doesn't need to relive the memory to do that. We can do that with what's called dissociated from the memory. So you're watching yourself, reliving the memory. So you're not actually remembering the memory itself, which is also very effective, because when people have trauma, they often don't want to relive that trauma. And so that's another way that hypnosis can help. And what resists persists. The more you try and suppress something, the stronger it's going to become. So hypnosis can help because it can allow increased states of mindfulness. It can allow you to not try and resist negative things, negative emotions that you don't want to have. You can just let them be, and as you do that, they start to lose their emotional charge.
Right. And how long do you think, like, if someone wants to get out from the chronic anxiety to like a fulfill living their best life, how long do you think the process takes on average clients? Obviously, everyone individual is different. So do you think like within 3 months, 6 month time, or like 1 year, like is a good time they can get out of their own trauma, anxiety?
Yeah, everyone is different. Many of my clients, I can help them in 3 sessions, so within a month. Some clients, it may take, 2 to 3 months. But yeah, most people can be helped within 1 to 3 months. 1 to 3 months using hypnosis can people start to see rapid improvements, rapid changes in their life.
Mm-hmm. Yeah, that's great. Thank you so much, Mark. So, Mark, it's been a great pleasure having you in the show. We are coming to the end of this podcast. So, those who's listening, if anyone wants to learn more about you, your program, where is the best place to find you?
Thank you, Russell. People can find me on YouTube. My name is Mark Stubbles. So if you just put that into YouTube, you'll probably bring up my channel. You can also go to my website, which is anxietyhypnotherapist.org. And I have a Facebook group, which is called Inner Child Healing Breaking Free of CPTSD. And that's a free group that people can join, and I post in there regularly.
It's great. Thank you so much for your time today. I wish you best of luck with your business, your personal life, and I hope you have a wonderful day ahead. Thanks for coming today.
Excellent. Thank you. Thank you for having me.
You're most welcome. That's a wrap, guys. Thank you so much for listening to this podcast episode. I hope you enjoyed the conversation and learned a few things from our expert today, the Mark. So if you want to reach out to him or learn more about, visit his website, or you can reach out to him on a social media platform, or you can check out his YouTube channel. So until then, I'll talk to you on the next episode. Take care.